Hi everyone, I'm Anastasia, your host for Coffee Chat with Anastasia, and I'm so excited that you joined me here. Our next 4 videos are going to share from our live event at Yankee Dental Congress with key opinion leaders. This was brought to us by Crest and Oral-B. It's meant to do 3 things. Number 1, empower the dental hygienist, because we face the same challenges clinically every day. Number 2, it's meant to help us educate our patients in acquiring and maintaining health. And number 3, it's meant to engage. So when you see these videos, if there's a question from a certain KOL that you have, comment. We're all here on this same journey. So together we can take what we learn and make a difference with it. Thank you for joining me.
To date, Dr. Levin has authored over 68 books, and he's published over 4,000 articles. Please give a warm welcome to Dr. Roger Levin. Yes.
I'm good at that.
Link for that. Thank you. Yes, kicked it off. It's official now. So what are you drinking?
Decaf, because if it's regular, I'll be up for the next 2 days.
Well, you're going to be up for the next 2 days. You're presenting here.
Yeah, true.
Every single day and almost every single patient, we feel like we want to make our patients happy. We want to make our patients healthy. And then, oh, by the way, we want to make our boss happy. And it is a business, so we also know that at the end of the day, we want our numbers to be happy and healthy. And that's really hard. That can seem like a really tough mountain to climb. So what would you advise the dental hygienists here in the crowd? How can we conquer that mountain?
Dentists don't fully understand the potential of the hygienist. You are highly trained, and in our world, in addition to the normal work you do, which is in changing the lives of your patients every day, there's an opportunity for, I'll use the word diagnostics. You're not allowed to legally diagnose, so we talk about diagnostics. And we train our hygienists to become diagnosticians. So we've got an hour. The majority of dentists spend 4.5 minutes in a hygiene check, if you can even get them in there within half an hour. Important. So the answer to the question is that your opportunity in an hour to identify potential treatment, both need-based and elective, is enormous. Your excitement and enthusiasm on health and beauty, which fits the whole Crest Oral-B theme, is enormous. And in that hour, we are training hygienists, and you're all capable of this, to do 4 things. Identify potential treatment, educate the patient about that treatment, motivate the patient to have treatment, and close the case, all the way down to fees.
Productivity. How can we, I don't want to use the word convince, but we will say, how can we sway our doctors who may not be sold on that, saying, I'm not sure that's going to be a fit for our practice to have oral home care products in the hygiene treatment room. What can we say?
Well, first of all, it is critical to be selling products, and nobody is better than hygienists. Now, dentistry is way behind because, and I'll explain it this way, dentistry is way behind. We have this image that if we sell products, somehow we cheapen ourselves. But it's absolutely wrong. First of all, we're talking about professional selling, not strong-arming people, not manipulating people. If you are not selling products, your patients are not going out and getting your recommendations necessarily. I don't know if this next statistic is true, but I was once told, I haven't seen the data on it, that 35% of medical prescriptions are never filled. Let's say it's 15. That's huge. And if they're not filling medical, they're not filling dental home care. So if you really care about your patients, and nobody cares more than hygienists, I mean, my respect for you is off the charts, then when you make a recommendation, you want to have it right there. And the other thing I know about mothers, because I'm married to one and I have one, and they make most of the healthcare decisions, they don't want to go one more place. They don't want to be sent to Walmart or Target. They would like to get it from you right there. And the script that we use is, Mrs. Jones, you can go to Walmart or Target. We give a choice. But if you would like to get it today, we have it right here for you. And that choice automatically has most people say, I'll get it right here. One of our targets is if your product sales are not growing every year, something is wrong. Because dentistry is about excellent clinical care, but it's also a business. That's the world I live in. I'm a dentist, but I also run a practice management firm. And because of that, I see both sides. And if you are not focusing on revenue opportunities in today's world, you might be flattening out or declining. So it's good for the patient, it's great for the practice, and to me, it's one of the most ethical things you can do. If you believe they should be doing something, we need to tell them and have it there for them. Dermatologists all sell products. Ophthalmologists have glasses stores in their offices. And my veterinarian sells so many products that my last dog, when he got older, you and I were talking about dogs, $178 for the medical prescription for the dog and the avocado supplements that he wouldn't eat. So, I still have them. This next dog, when he gets a little older, he's going to eat these supplements. So why are we different than the rest of medicine? And we shouldn't be. There's no reason.
Here tonight. So thank you. That was so generous. And I will link to that. Thank you.